20 kilometers south of Johannesburg, on the outskirts of Soweto, you will find the world's third largest hospital, the Chris Hani Baragwanath Academic Hospital. This state-funded hospital relies on public or private partnerships as we strive to be at the forefront of world healthcare. Surgeons for Little Lives is a registered non-profit organization and was created by pediatric surgeons in 2015 to improve the care received by our young patients and their families. We are powerfully committed to saving the lives of sick children.
So essentially, pediatric surgery is operating on children. So children are often born with congenital abnormalities which need urgent repair. More often during their lives, they acquire conditions that need to be treated surgically. And it's our job to treat them and to get the best possible outcome for them that we can achieve. So interestingly, the pillars of our care are aligned to those of Wits University, and they are centered on clinical service, on teaching and training, on research, and on effective administration. So the clinical service is obvious, and just to say that the department is the largest and probably most successful of its type on the African continent now, treating a hugely high volume of pediatric surgical children, which is now extended to children in general, as well as their families. From a training perspective, obviously our core focus is on training the next generation of pediatric surgeons. The fantastic thing about Surgeons for Little Lives is that we haven't limited that focus on training to just our pediatric surgical registrars, but we've spread it to the nursing staff that we employ, to the allied healthcare professionals, so that we can lift them to the highest possible standard of care that they can provide too. So research is obviously super important in all aspects of medicine, and Surgeons for Lives has done a great job of supporting research in the Department of Pediatric Surgery. The ultimate result is that it's allowed the Department of Pediatric Surgery at Wits to develop a leading national and international footprint, and to really establish us as leaders in the provision of this care in South Africa. So obviously administration is something that people don't like to think about. What we are proud to say is that whilst in excess of 85% of all of our revenue goes directly to the patient and their families, we've been able to support the employment of 7 people within Surgeons for Little Lives that all come directly from the community. And it's just really nice to be able to have that impact on the community that we serve. So that's been really cool. So Wits University are in the process of establishing their strategy for 2033. And there's 4 key words that have been identified to date. And those are establishing an identity, having a social impact, sustainability, and academic excellence. And it's certainly super proud for us to be standing here as Surgeons for Little Lives in partnership with the Department of Pediatric Surgery, knowing that we've already ticked all of those boxes.
Since 2015, Surgeons for Little Lives has worked on a variety of initiatives across the board, from creating admission packs, implementing rehabilitation and art projects, through to providing a playground, upgrading ward facilities, and our amazing outpatient and parental sleepover facility. The massive growth of our research facilities has enabled significantly increased outputs. One of our latest projects is working with Henri Leroux and her SCAN program.
The SCAN program is Suspected Child Abuse and Neglect. It's a program that I've started at Chris Hani Baragwanath Academic Hospital. The goal of the SCAN program is to detect suspected child abuse and neglect, to prevent child abuse from happening, and to protect children from abuse. So through the SCAN program, we try to increase the good by decreasing the bad and prevent it from being ugly. So the first step is to identify abuse. We want our healthcare workers to recognize if a case presented as a result of suspected child abuse and neglect. After a case has been identified, they refer the case to SCAN. This is where I go to the wards and assess the children, and then also assist in the further management. It's a multidisciplinary approach, so we get everyone involved. This includes other medical departments, also social services and psychological therapy. The Surgeons for Little Life organization supports me and the SCAN program by believing in the program, seeing that it's something that they also stand for. Together we will work to create a wider awareness in the community and protect children from suspected child abuse and neglect.
Here are a few personal comments from our patients and staff.
I want to take this moment to thank all the doctors, the surgeons, the nurses, and even the cleaners of Chris Hani Baragwana for the love and care they give to us.
Bless you guys, you did a very great job. We didn't expect that this thing can be like this, but we are happy.
I can't believe my child healed so fast.
On behalf of the dietetics department, we salute the surgeons and nurses on a job well done.
I suppose Surgeons for Little Lives is a line in the sand. It says we can offer this care because of the resources we have, so we will offer this care. And I think most days we get it right.
So Surgeons for Little Lives has been a wild ride since its inception in 2015. The learning curve has been huge, the growth has been phenomenal, and really all on account of the fantastic support that we've received from our communities. The incredible thing is that through everybody's support, we have been able to make such a fantastic difference to the lives of our patients and the families that look after them. Whilst we continue to plan our new projects, both big and small, our focus for this evening is going to be on consolidation. It's going to be on financing our essential wish list items, and then it's going to be on launching one new project, the SCAN project, which you've already heard about, which really is aimed at supporting and caring for those children in our community that are intentionally abused and for which so little is done and so much more needs to be done. And finally, to you, our valuable donors, I just want to thank you all for the support that you've all given us over the years to date, and really just to plea for your ongoing support, both as individuals and as the institutions that you represent. This in the knowledge that in excess of 85% of all funds raised goes directly to the patients and to the families that care for them. Thank you.